So at ASCO this year, we presented results from the ASCENT04 study, a randomized phase 3 trial comparing sacituzumab govitecan plus pembrolizumab to chemotherapy plus pembrolizumab in patients with previously untreated PD-L1 positive metastatic triple-negative breast cancer. We know that about 15% of breast cancers are triple negative, and about 40% of those cancers are PD-L1 positive. And the median progression-free survival that's been observed in prior studies looking at the combination of chemotherapy and checkpoint inhibition has ranged between 7 to 9 months. We also know that about half of patients who start first-line therapy for metastatic triple-negative disease are not able to go on to receive a second line of therapy, either due to deterioration in health or death. Sacituzumab govitecan is a TROP2-directed antibody-drug conjugate that has demonstrated improvements both in terms of progression-free and overall survival when compared to chemotherapy in pretreated metastatic triple-negative disease, and is currently approved as a second-line and beyond treatment option for patients with metastatic triple-negative breast cancer. There's been a lot of interest in trying to combine an antibody-drug conjugate with a checkpoint inhibitor, given both robust preclinical and clinical data for the combination. And so here we're presenting the results of ASCENT04, looking at the combination of sacituzumab govitecan plus pembrolizumab. Shown here is the study design for ASCENT04. Eligible patients were required to have previously untreated, locally advanced, unresectable, or metastatic triple-negative breast cancer. Their tumors had to be PD-L1 positive using the 22C3 assay with a combined positive score of 10 or higher. Patients could have either had de novo metastatic disease or had to be at least 6 months out from completion of systemic therapy in the early disease setting. And prior use of a checkpoint inhibitor in the early disease setting was allowed. ER/PR, HER2, and PD-L1 were centrally tested prior to enrollment, and patients were stratified by 3 factors: whether they had de novo versus recurrent disease based on timing from recurrence, geographic location, and prior exposure to a checkpoint inhibitor. A total of 443 patients were randomized to receive sacituzumab govitecan plus pembrolizumab, or to receive chemotherapy of physician's choice plus pembrolizumab, where choice of chemotherapy could include either paclitaxel or nab-paclitaxel or carboplatin with gemcitabine. For those patients randomized to the chemotherapy plus pembrolizumab arm, crossover treatment to sacituzumab govitecan monotherapy was offered and provided during the crossover phase of the study for those patients who had centrally confirmed disease progression. The primary endpoint was progression-free survival by blinded independent central review. Here you can see the patient demographics really suggesting that these arms were very well balanced. About 34% of patients had de novo metastatic disease, 18% had recurred within 6 to 12 months, and 48% of patients had recurred greater than 12 months from completion of adjuvant systemic therapy. The majority of patients had visceral metastases, with about 50% of patients having lung metastases and 25% of patients having liver metastases. Choice of chemotherapy had to be selected prior to randomization, and for those patients in the chemotherapy plus pembrolizumab arm, about half the patients received taxane therapy and about half received carboplatin plus gemcitabine. And about 5% of patients had received a prior checkpoint inhibitor for early disease therapy. Shown here is the primary endpoint, progression-free survival by blinded independent central review, demonstrating that sacituzumab plus pembrolizumab led to statistically significant and clinically meaningful improvement in progression-free survival, with a median PFS of 11.2 months for sacituzumab plus pembrolizumab, compared to 7.8 months for chemotherapy plus pembrolizumab, with a hazard ratio of 0.65 and a p-value of less than 0.001. Shown here are the data for overall survival, which is very immature at this time point, with just 26% of survival events having occurred at this data cutoff. But you do see a positive trend favoring sacituzumab plus pembrolizumab compared to chemotherapy plus pembrolizumab, with a hazard ratio of 0.89. It is important to note that 43% of patients in the chemotherapy plus pembrolizumab arm had crossed over to receive second-line sacituzumab govitecan monotherapy, And this really represents about 80% of patients who received any subsequent treatment after discontinuation of chemotherapy plus pembro. You can also see that the response rate is higher with sacituzumab plus pembrolizumab at 60% compared to 53% with chemotherapy plus pembro, as is the complete response rate at 13% compared to 8%. And importantly, the duration of response was substantially longer with sacituzumab plus pembro, with a median duration of response of 16.5 months compared to 9.2 months. When looking at the adverse events, you can see that the number of grade 3-4 adverse events was similar between the two arms. Numerically, there were more serious adverse events with sacituzumab plus pembrolizumab, but there were fewer dose reductions and fewer dose discontinuations with sacituzumab plus pembro compared to chemo plus pembro. So in conclusion, ASCENT04 is the first randomized phase 3 study to evaluate the efficacy and safety of an antibody-drug conjugate with a checkpoint inhibitor as first-line treatment for patients who have PD-L1 positive metastatic triple-negative breast cancer. The combination of sacituzumab plus pembrolizumab led to statistically significant and clinically meaningful improvement in progression-free survival with the median PFS of 11.2 months compared to 7.8 months with a hazard ratio of 0.65, and benefit that was really seen across most pre-specified subgroups. While overall survival data are immature, you can see that there's an early trend favoring sacituzumab plus pembrolizumab, despite seeing a very high crossover rate to sacituzumab monotherapy. Objective response rate was numerically higher, as was complete response rate, and duration of response was substantially longer. The safety profile for sacituzumab plus pembrolizumab was really consistent with what is known for toxicities of each agent, suggesting no additive toxicities. And so the combination of sacituzumab plus pembrolizumab may represent a new standard of care option for patients who have PD-L1 positive metastatic triple-negative breast cancer. Thank you.